Good morning, Ilanko. Welcome to the show.
Good morning, James. Nice to meet you.
Thank you for joining us today. So this is a timely discussion around HIMSS. We're having a discussion on Genzeon, the company that you lead, that is a very close partner with Microsoft in the healthcare space. So Ilanko, could you talk to us a little bit about your company and your role, and then we can get into the wonderful solutions that we're collaborating with you on.
Absolutely, James. My name is Ilanko Kumaresan. I am the CEO of Genzeon. I've been here for a couple of years now. Before that, I spent a year at McKinsey as a senior advisor to their healthcare and TMT teams. And before that, I spent 26 years at Cognizant building up their healthcare business in US. That's kind of my background. Genzeon is a healthcare solutions company. We go to market in a 3x3 frame, 3 platforms and 3 services we take to market. The first platform is a privacy automation platform that helps healthcare companies achieve HIPAA compliance and privacy. Second platform we call as Health Intelligence Platform. It's focused on medical review and prior auth. It's a AI platform that helps nurses productivity in when they do medical review and prior authorizations. And the third platform is patient engagement, which is something we built on top of Microsoft's Health Agent Service, right? And that helps call avoidance for hospitals. Right? When somebody calls, the platform can listen to the call, understand the intent, and route the call. Right? That's what that does. And on services, we do AI and automation, data, and AI native engineering. Right? That's what we take to market. That capability is to not only implement our platforms, but also help clients build other solutions to solve healthcare problems. That's what we do.
So these are 3 highly relevant solutions for today's market. So you have privacy, patient privacy, you have intelligence, and you have patient engagement. How have these solutions evolved over the past 18 months, given agentic AI? And what do you see coming in the next 12 to 18 months?
Absolutely. I think it's very a great question. The market is moving very fast. And I mean, I've been in healthcare almost 30 years, but I've never seen healthcare adopt a technology as fast as AI seems to be entering healthcare space. It's exciting. It's wonderful to see. People in healthcare always feel we are a laggard compared to others, but I think when it comes to AI, I think people are seeing the possibilities, right? Over the last couple of years, I mean, when we built this health intelligence platform, we first built it on the cloud using LLMs. And then we had a client that did not want data to go out of their ecosystem given the regulatory constraints and so on. So we actually built it using SLMs and VLMs to achieve the same outcome in terms of understanding medical record, summarizing using Gen AI, and help the decision making using AI. Over the last 18 months, the number of tooling, the capabilities that AI can bring to bear to achieve some of the things we are achieving would not have been possible even 3 years ago, right? So that's the speed with which the market is moving. I mean, even the government has gotten into it, right? I mean, our HIP1 platform last year was chosen by CMS as they are bringing in AI into prior authorization in traditional Medicare. And we are now doing it for the state of New Jersey because of CMS's selection from January of this year. So you can see this market moving fast and healthcare organizations adopting AI and the government stepping in and saying, how can I use UI, AI to reduce cost?
And for those that are not familiar with the U.S. healthcare system, could you explain what CMS is?
Yeah, CMS is the largest payer in the country, right? CMS is Center for Medicare and Medicaid Services. They administer both Medicare and Medicaid, right? Paying out about 1.5, $1.6 trillion every year, right? In bills, right? So, and both of them, I mean, Medicare insures 40 to 50 million people, and Medicaid insures 70 to 80 million people, right? So that's what CMS does. And so they're very keen to make sure we eliminate waste, fraud, and abuse when it comes to usage of services. Even when you make decimal point improvements, it has a meaningful impact on the overall cost on the federal budget.
So the law of large numbers, if you can save 0.01% on 300 billion, there's very happy people.
Absolutely. The idea is not to deny care for people who need it. Absolutely not, right? But we are only focused on how do you use AI to identify where waste, fraud, and abuse happens, right? I think that's the idea, right? But people who need care should continue to get care.
So let's talk about that CMS project. CMS selected your solution. Let's talk about why they selected your solution, what the use case is, and how other organizations should think about making similar choices.
Yeah. So, July of last year, CMS issued an RFI, and they deliberately said they only want AI companies to respond to it, right? And that's kind of otherwise a company like us, which are a relatively a smaller player within the ecosystem, they liked what we were able to share about our platform, and they chose us, and they gave a 3-month timeline to go live to handle the prior auth for about 16 services in
3
traditional
months?
Medicare, like 3 months.
Wow, impressive.
So there are 1.3 million people who in New Jersey that are on traditional Medicare, and they chose 16 services as they considered the costs have been going up 20% year on year, and they felt that is overused, that is faced fraud and abuse, and that's kind of why they chose that. And so from January 5th, we went live, and in the last 2 months that we have been in production, processing all of this, we are able to start. We will know in, I think, by end of Q1, there is a checkpoint to see how the program is proceeding. Are we meeting the goals and so on? But so far, things have gone as expected, right? And people are getting the care, but we are identifying where it doesn't adhere to the CMS guidelines on when you should use certain services, right? And I think medical necessity and whatever else, right? So CMS had a guideline that said you can approve using AI, but any denial has to be done by a MD, right? In this, so that's how it is set up to make sure that people who need care are getting the care, and AI is not making the decision. This goes back into trustworthiness and reliability and so on, right? So it's AI is still relatively new. People get very worried when you say you are going to use AI to make a decision. So that's why CMS set it up like that, and I think it's a smart thing that it is set up like that. That gives people comfort that it's a qualified MD making the decision and not AI when it comes to denials. But from a CMS perspective, today, if you do both manually, you'll spend a lot of money doing both. By using AI, you can significantly reduce that cost.
So the ROI for the state, in this case, for CMS, what is being converted back into value to the citizens.
Yeah,
It's
so
not
two
about
things,
cost
right?
takeout, it's about improving service.
100%, right? So it does achieves a couple of things. One, it makes sure that people who need care are getting it, because if the volume of, be it skin grafting, epidurals, or stimulation, all kinds of services, if the usage shoots up, I mean, you know about the shortage of clinicians and nurses in this country, and that makes care difficult to access. So by making sure that overuse is curtailed, fraud and abuse is curtailed, people who need the care or get the care, right? So that's number one, right, in terms of improving access. And number two, by reducing the administrative cost of using, instead of using humans to do the approval, using technology to do the approval, you are reducing significant cost, admin cost of this whole program, right?
And the responsiveness has probably improved quite a bit as well because it is automated.
Exactly right. I think, yeah, our goal is to try and see if we can achieve in hours, not days, right? Today it takes a few days to get some of these things approved. Now, this definitely helps us move much, much faster.
Excellent. So let's talk about the patient engagement solution. How is that transforming the patient experience?
Yeah, so it's actually a nifty solution that I don't know whether you may know this, right? Microsoft bought Nuance a few years ago, and Nuance, all of us are familiar with the Dragon, naturally speaking, software, which is the most powerful voice recognition engine that's out there. And Microsoft exposed that engine using something they call Health Agent Service. So our platform is built on top of that. So and we have two of the top 10 health systems in this country using this platform. And what they use it for is a patient. You may call the hospital, say schedule an appointment or a follow up to your visits. So our platform can listen to the call, route the call to the right department, thereby reducing the amount of touch points a human have to before you reach the right person, right? So the AI can intelligently route the call, make sure that you're not spending a lot of time talking to multiple people. I mean, we all have been there from one person to keep shifting to three people, right? This avoids that, right? And I think so it's a great customer experience aspect to it, and it also reduces the number of calls the call center has to handle from a hospital standpoint, right? So it actually achieves both of that, and the results have been pretty great. There are clients that use our platform today, and it's getting great reviews, and we look to expand it further along with Microsoft in the future.
So Alongo, so customers that are considering programs like these, one of the conversations that I'm having is on data, right? Is my data ready for that AI overlay on top of the data, right? How should customers think about their data, assessing it to determine whether it's ready and getting it ready for working with an organization like Genzeon?
Yeah. So there is a reason why Genzeon, we take three platforms to market, but we also take three services to market, right? The reason is that services are very important to make platforms successful for our clients, right? One, it goes hand in hand, right? So, I mean, people often ask me, are you a product company or a services company? I always say, I am a client services company, right? If I can solve a client's problem using native Microsoft technologies to build a solution, I'll do that, right? I'm a 100% Microsoft shop, right? I do all aspects of Microsoft from Fabric to Azure to Copilot and others, right? So depending on the right tool, I want to be able to solve a problem. And when you see the problem in multiple clients, that's when we think of building a platform, right? That's the way we operate. So, to your question about data, we have invested heavily in building up our Fabric and Databricks capabilities within Genzeon, right? So, before we implement platforms, we do work with clients on that. The quality of the data governance, the cleaning of the data to make sure that the right data is there so that when we either use our AI platform or use Microsoft Copilot to be able to build Copilot solutions for clients, which we do as well. We also use Fabric to modernize the data for clients, right? So I think that's a significant practice for us. And number of clients, you have seen the growth of Fabric in the market, and so has Databricks and others. Two great platforms that do really well. Is very important for us to achieve quality of data before you can get the right value out of for AI. And so that's an important piece of the service we bring to market.
So let's talk about HIMSS, Ilango. What are you looking forward to in HIMSS? What are the conversations that you look forward to having with industry?
Yeah, so there are a couple of things. We are very excited about HIMSS. A lot of our clients are at HIMSS, and we look forward to meeting them, having great conversations. But there are two or three solutions we want to highlight at HIMSS as well, right? So, one, we built a solution on Copilot to help providers compare what they got paid versus what they got contracted, right? So we call it payment variance. It's an RCM Copilot. We used Microsoft's Copilot to build that, right? And we call it REVA, right? So it's a solution we are showcasing in Microsoft's booth. Microsoft chose this to showcase in their booth, so we are quite excited about that. We want to talk to clients about how we can help use Copilot to solve some of these RCM challenges they have, right? That's one. Second is we have a theater session where we are going to talk about the patient engagement solution that I talked about, and it's built on top of Health Agent Service. So Microsoft and teams are very excited about that solution, and those two we are going to talk a lot about in HIMSS, and we are looking forward to meeting a lot of clients to understand what are the adjacent problems we can solve, whether it is in patient engagement or in RCM within provider space, right? Two key areas for our clients. As you know, hospitals, especially in the last year or so, reimbursements have been cut in Medicare and Medicaid, and it's impacting a lot of our clients. So they are all under significant margin pressures. Anything that we can do to improve collections for hospitals using REVA or improve the patient experience using patient engagement is all very valid and timely for our clients. And that's what we want to spend time in.
Excellent, excellent. So Ilango, I would like to thank you for being an awesome partner for Microsoft. Welcome to HIMSS. Welcome to our collaboration at HIMSS. So very appreciative of the work that we're doing together. Thank you.
Thank you, James. It's wonderful to talk to you.